Open communication and trust are the foundations of any partnership. To demonstrate respect and value for the patients and families that pediatric practices serve, it is important for clinicians to create partnerships with families by giving them a role in the health decisions for their child. Families are likely to return to a practice when they feel like they are a part of the process rather than just a number in the rotation. And mutual respect develops because of the partnership with the pediatric care team. One way to support mutual trust and respect between a pediatric care team and its patients and families is by practicing care partnership support. Care partnership support is meaningful collaboration between families and the pediatric care team to ensure effective and quality care for the patient. This support is designed to address family and patient access to quality care and effective communication, which are the cornerstones of a successful patient and family-centered medical home. A medical home uses a team-based approach to care. It is led by pediatricians or family physicians and will likely include nurses, nurse practitioners, physician assistants, medical assistants, office staff, parents, and caregivers, among others. A pediatric medical home works with families to enhance their child's well-being, including physical and mental health. Families and patients are becoming more involved in their own health care and often welcome opportunities to participate in decision-making. That's why an important part of the patient and family-centered medical home occurs when the pediatric care team seeks input from families and patients. Families will be empowered by being involved in their child's medical care because they know their child better than anyone else. Parents are experts on their child and their family situation, while the care team is the expert in the medical and clinical care. An example of care partnership support is when a parent and pediatric clinician work together to develop a written care plan for the patient. The pediatric clinician makes recommendations about the options for the child's care, while the parents talk about how these different options will work for their child and their family. Priorities are set, and the parent and pediatric clinician work together to decide what will be the best approach for the child. Each family's individual circumstances are unique and must be considered for the care plan to work well for them. It is never one size fits all. The idea is to create a care plan to fit with the child's life, not to try to force the child's life around the plan. Family goals, priorities, and values should be taken into account because decisions made in the practice affect the daily life of a child and a family. When the pediatric care team uses the parents' knowledge about their child and family to formulate a care plan, the results from the collaboration are more likely to result in improved health outcomes. Care that is planned in partnership with older patients is also more likely to be followed and gives them some ownership over their medical care.
Hi, Mackenzie. How are you today?
I'm good.
That's good. So I understand we are talking about your 6-month goals today for asthma?
Yeah, I wanted to talk about it because if I miss any more school, they might hold me back.
Why are you missing so much?
Well, my asthma got really bad because I kept forgetting to take my medicine.
So we need to talk about ways to help you remember.
I guess I could put a reminder in on my phone.
That's a really good idea. There are also apps that you can download to help you remember to take your medication.
Really? I didn't know that. I think that'll help me a lot.
Great.
As you can see, collaboration between a pediatric clinician and patient is much more likely to result in improved health outcomes. The pediatric care team also uses care partnership support to help patients gain access to support services, specialty care, medical records, and educational resources that are easy to understand and potentially available in different languages. In addition, the team can help families develop a written care map to visualize all of the partners in their child's care. Because all patients and families have unique life situations, strengths, and challenges, all care must be tailored to each patient and family's values and culture in order to provide the best care. Families who are refugees, immigrants, or experiencing homelessness have additional challenges, including knowing how to navigate the healthcare system. Because families may feel overwhelmed with their life circumstances, they may have a difficult time managing their health care. So it is especially important to support and partner with families in these situations to make sure their needs are met, including referring them to appropriate community social services. The better the interaction and planning, the more likely the patient will follow through. Health literacy is also an important part of care partnership support. It is sometimes assumed that if an individual has good general literacy, then their health literacy is adequate as well. However, it's important that pediatric care teams ensure that parents and caregivers understand the medical information that is being communicated to them, since most health management takes place at home. Patients and families may be intimidated by the office environment or the medical staff. Taking the time to explain the details in simple language will go a long way towards patient and family understanding and compliance, and may ultimately result in better health outcomes. If you decide to start practicing care partnership support in your practice, first, establish a policy that is agreed to by the entire staff. The policy should be accessible through practice marketing materials or the practice website and displayed in the office. Help families understand that they are a valuable member of the medical home team, and let them know that their views and questions are always important for both the immediate and long-term care of their child. The pediatric care team's accessibility is very important to care partnership support too. Being able to have questions answered in a timely manner between scheduled appointments and seeking input on a regular basis will really help to develop an open and trusting relationship between families and the pediatric care team. In essence, both partners are working toward the same goal: quality medical care. This is what the pediatric care team wants for patients and what parents want for their children. Incorporating the care partnership support concept into a medical home allows and encourages pediatric clinicians, parents, and caregivers to work together. The result? Improving the current health of the child and developing future care goals. This worthy objective is something that both the family and the pediatric care team strive to achieve. For additional information, access the resources and tools available from the National Center for Medical Home Implementation. National Center staff is available to support you and your practice in working to ensure that every child and youth, including those with special healthcare needs, has access to a medical home. This video is funded in part by the Friends of Children Fund, a charitable fund of the American Academy of Pediatrics. Contributions to this fund enable the AAP to support high-priority activities, respond to emerging child health issues, and continually generate new knowledge about the best way to care for children. For more information about the fund, please visit aap.org/donate.